Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hi, my name is Linda Crandall. I'm a member of the Senior Advisory Council at Northwest Seniors and Disability Services. Today I'm interviewing Lori Chavez DeRemer. She is a Republican candidate for Congress District 5. We'll be asking Lori questions related to seniors and people with disabilities. Welcome, Lori, and thank you for sharing your time with us.
Thank you for having me.
The first question that I have for you is, how have you advocated for seniors and people with disabilities in the past?
I took this question as far as, in the public realm. As mayor, obviously we work with our county governments. I was served as mayor of Happy Valley from 2010 to 2018 and recognized that this is a service that's needed in all communities. And so working with the county through that, as well as the private sector with chambers and or Rotary, and making sure that we can advocate for all seniors in our community. So not so much have I done any advocating in a policy level at the state level or federal level in that realm, but more on the local side.
Thank you. The Older Americans Act provides critical programs for older adults in Oregon. As Congress considers funding for fiscal year 2023 and 2024, how will you protect and continue to increase funding for Older Americans Act and other aging and disability programs?
I think it's probably one of the things that we have to think about. As I read through the funding, $264 billion, that's kind of not increased very much actually over every annual cycle. And so I was thinking about now more than ever what we're experiencing with inflation, with older Americans, with Americans with disabilities, seniors with disabilities, and how that number is going to continue to increase. The certainty factor, I'm sure, weighs in on those citizens as well as the electeds in voting for that. So at this time with inflation, I think if there's anything we can do, we have to hold that line for those securities. And I read through, of course, all the details in all of the titles and how difficult that must be. When we're receiving the dollars and transferring minimums and so forth. So I think holding the line of $2.46 billion is impressive. But if we don't do it with certainty over time, I think we're going to be in a world of trouble. So I'm looking forward to supporting where we've been and finding ways with our local communities to ensure that our seniors with disabilities are taken care of. They're the greatest generation, and it is something of a concern.
Thank you. How will you address food insecurities for seniors and people with disabilities?
Again, access, right? When we're talking about regulations and or budgeting, often one of the things that comes to my mind, at least as a mayor, when I'm dealing with stuff, is access and local access. And I recognize that some of the counties that you all serve is just a small fraction of what we're talking about here in Oregon. And working with our counties and the public-private partnership, I think, is also important. One ways we can reduce costs, obviously, is to keep people in their homes. Looking at the comparisons between homes and facilities, the price difference is exorbitant. And if we can keep seniors in their homes with disabilities, I would like to be able to think about transferring some of those costs to food securities and how we can work with our public and private partnerships on the city levels, county levels, to do so and make sure that we're recognizing that we need to feed our seniors and make sure they have access to those meals every single day.
Thank you. What are your plans to improve the health of vulnerable seniors and people with disability?
Yeah, I come from the healthcare industry. While I'm not a provider, my husband is an anesthesiologist, and we are in that sector when we're talking about comprehensive health. Because when we think about that, we think about mental health, we think about physical health, we think about, are they being fed? Are they being cared for? Are they lonely? How do they have that access? So when we're talking about comprehensive health, I think, is kind of maybe something that we miss often. We don't really think about it in a holistic approach. So I want to make sure that we can increase it by maybe some telehealth medicine. The rural divide, we don't often get to those seniors who don't have access. Broadband, making sure all those things come into place when we're talking about policy. And again, I always direct it back to local government because we're right on the ground making sure that we can protect our citizens every single day. So I think there's lots of avenues that we can reach out to and make sure that we can secure overall comprehensive health for our seniors.
Thank you very much. What will you do regarding Medicare and Medicaid to keep Oregon seniors and people with disabilities in their homes with access to mental health and substance abuse services?
Yeah, it's quite the sector, isn't it, that we're experiencing across all sections of mental health and substance abuse. And again, for seniors with disabilities, often they don't have those access points. And it might seem a little trivial, but when we're talking about just transportation, when we're talking about, can we get the caregiver in their home? Can we get the mental health caregiver in their home? Can we get support to their families to let them know that they can, that there is, even sometimes reaching out for communication. Most people don't even know that there are these services in their communities and how important it is, because what we don't want to do is transport seniors with disabilities outside of not only their home, but if we can't keep them there, then we have to transport them outside of their communities. And we know that people love to stay in their community. So making sure that through Medicaid and make sure we're funding that for our seniors as a whole, even without disabilities, we have to know that they have to have prescription drug costs that are accessible, keeping the mail available so they can get drugs in the mail. I mean, there's just so many points to talk about that we make sure that we have to fully fund those avenues, because again, I'm not going to say it lightly. They're the greatest generation and they're our seniors and they're such a fabric of our community. And I want to always protect that.
How will you address the lack of accessible, affordable housing for seniors and people with disabilities?
Yeah, again, affordable housing, we're having such a shortage in general across this nation. But in Oregon, housing is a shortage now. And now with inflation and building costs and where we're going to put these facilities. And again, how do we keep them in our communities? Working with city government, working with county government to identify where that land use can be, where those zoning are, and making sure that we're protecting that zoning, making sure we can reduce some regulations to keep the costs down. We can't produce affordable housing for anybody, and including seniors with disabilities. If the cost per door is $250,000 or $300,000 a door to build them a home that they feel safe and secure in, and then have access to their families and all these. So this is a big, broad spectrum. We're talking about land use when we're talking about funding and keeping those people where they want to be. Seniors, they've dedicated most of their life to their communities with disabilities. They're the fabric of that. And I say that with great heart as a mayor, and I want to make sure that we can have them stay where they want. We don't want to, say there's this facility somewhere else that you can go to. They want to stay home. It's cheaper to stay home. The funding services that you all do, it's cheaper than putting them in a facility. These people, and I just will always go from with the heart of being a mayor and as a community leader. So working with the private sector, public sector, there's ways to reduce regulation and produce the funding that you all need, your agencies need, to reach those titles and make sure that we're fully funded. And $2.46 billion. As I've looked from 2004 till now, I kind of look back at the charts. It hasn't increased that much, and I would imagine those numbers are increasing as people live to be a longer age, and we need to make sure they're protected.
Thank you so much. We've been visiting today with Lori Chavez DeRemer, a Republican candidate for Congress, District 5. Thank you for joining us today for this interview with Lori Chavez DeRemer, a Republican candidate for Congress, District 5.
Thank you.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.